Good day, learners. I'm Gapuz. I'm a test preparations coach for the last 25 years, and I've been doing coaching classes for NCLEX RN, both here in the Philippines and internationally. I'm also an author of 2 test preparations guidebooks for the NCLEX RN, which are internationally published. My Western and my Eastern education has enabled me to come up with guidelines, which I call functional concepts. And these concepts are the ones that are helping nurses to deconstruct questions on the NCLEX RN. So I'd like to share with you some of these functional concepts as we engage in our learning sessions today. Good day, learners. We're now moving on to lesson number 41. If you would ask me, what would I study in preparation for the NCLEX RN? Then one of the topics that I'd like to highlight would be the assessment of cranial nerves. Now, today we're going to talk about how to study the 12 cranial nerves such that we would be able to empower ourselves to be able to answer questions related to this concept. So let's learn together. If you have some more interest in learning with me, okay, so for more instructional videos, kindly subscribe to my YouTube channel, Gapuz Mentors. Don't forget to hit the bell button so that you'll get notifications when I upload my new videos, and my Facebook page, Mentor Ray. Now, if I'm going to study the assessment of the 12 cranial nerves, I would definitely break it down such that it becomes more chewable. So I will begin breaking down the concept in terms of the classification of the cranial nerves. So we all know for a fact that out of the 12 cranial nerves, there are 3 sensory cranial nerves, namely olfactory nerve, the optic nerve, and the vestibulocochlear nerve. So this is our first functional concept. Remember, functional concepts are, it could either be in the form of a word, a phrase, a sentence that serves as a guide to help you deconstruct questions on the NCLEX RN. In essence, it serves as your guide. So let's begin with a sample question. Knowing that there are only 3 sensory cranial nerves, we can already use that knowledge from that functional concept to answer a question. So here's a sample question. Which of the following cranial nerves are classified as sensory nerves? Select all that apply. We just said that we have 3 cranial nerves that are considered as sensory nerves, and those are cranial nerves 1, 2, and 8. So we put a check on olfactory, a check on optic nerve, put an X on oculomotor, a check on vestibulocochlear nerve because we've learned that. And since we all have already identified 3, and then it's actually logical to put an X on the next 2. And those are your cranial nerves, trochlear and abducens. Options 5 and 6. So the correct answers are, the sensory nerves are cranial nerves 1, 2, and 8. Olfactory, optic, and vestibulocochlear nerves. Now, the next functional concept would be each of the 3 sensory nerves have specific functions. So let's figure things out. For the olfactory nerve, the function is primarily for the sense of smell. Now, the next question is, how do we assess the sense of smell? So we actually ask the client to smell either coffee or lemon peel, and then we note for abnormalities. Now, how would you know that there are certain abnormalities? So the first abnormality would be anosmia, or the loss of sense of smell, which is kind of dangerous because when there's a gas leak inside the house, the patient would not be able to smell it. The second abnormality would be parosmia, or the inability to identify odors or natural smell. So in other words, the patient may not be able to detect odors, or there could be distortion on how they perceive others. Next, let's move on. For cranial nerve 2, you have the optic nerve. Now, the function of the optic nerve is actually for the sense of sight or vision. Now, how do we assess cranial nerve 2? We assess cranial nerve 2 by focusing on 5 areas. And the first one is actually assessing visual acuity. And to do so, we need your Snellen charts. Okay, so what do we ask the patient? We ask the patient to either sit or stand 6 meters or 20 feet from the chart. And then we ask the patient to cover one eye and read the letters from the biggest to the smallest. And then that's also done on the other eye until such a time that the patient may experience difficulty, and that has to be communicated to the healthcare provider. And then we also need to assess the patient's ability to discriminate color using the Ishihara plates. Now, this is actually intended to assess the presence of color blindness in the patient. And within each plate, we usually have a pattern that are colored differently from the rest of what you have on the plates, and the dotted colored patterns are actually either in the form of a shape or a number. Now, if the patient is unable the numbers or the shape that's contained in the plate, then that may potentially indicate color blindness. And then we also need to assess the patient's visual fields, and to do so, we ask the patient to position himself or herself face-to-face with the healthcare provider. And then we spread our arms and wiggle our fingers. And then we ask the patient to identify which finger is moving. Okay? And then after that, we need to assess for visual reflexes. And this is done by placing one hand vertically along the nose. And then we use a pen light and turn on the light on one side, making sure that the light doesn't pass through the hands. And then we check if both of the eyes will react by constricting simultaneously. Okay? And last but not the least, we need also to perform fundoscopy or ophthalmoscopy, which involves the visualization of the retina. Now, this assessment method would actually enable us to determine if the patient would have conditions like hypertension or diabetes. Now, what sort of abnormalities could be noted when we are assessing cranial nerve 2 or the optic nerve? So we have homonymous hemianopsia, in which there's a loss of visual field on half of the eyes, which means the patient could only see either on the right half of each eye or on the left half of each eye. So how would you know that the patient's having homonymous hemianopsia? More frequently, this is manifested by the patient when they are unable to see and eat the food on their plate entirely. So such that they only consume half of the plate, of the food on their plate. It's because their sense of sight is impaired on the other half. That's the reason why for this type of conditions or abnormalities, the patient is usually given a nursing diagnosis of unilateral neglect. That is, they are unable to see half of the visual field. Okay. Now, another abnormality that we need to assess the patient for would be optic neuritis, which is usually the inflammation of the optic nerve, and that could potentially also lead to vision loss. Now, the 8th cranial nerve, the third of the 3 sensory nerves, is actually your vestibulocochlear nerve. Now, of course, the main function of this nerve would be to assess one's sense of balance. The caloric stimulation test is usually performed. Now, this test involves the instillation of alternating cold or warm water or air into the ears. So, it detects damage to the acoustic nerve. Now, how would we know that the test is positive? The test is considered positive if there's nystagmus, or the involuntary movement of the eye. Now, if there is moderate nystagmus, that usually potentially indicates Meniere's disease, which is due to the imbalance in the endolymphatic fluids in the patient's inner ear. Now, what about if a patient has an absence of nystagmus? Now, this could potentially indicate acoustic neuroma. Now, when a patient has acoustic neuroma, this is actually the presence of a non-cancerous tumor in the patient's vestibulocochlear nerve. Now, the common manifestation of acoustic neuroma would usually involve ringing sounds in the ears or tinnitus, and then this would progress eventually to hearing loss. And then the patient may exhibit difficulty maintaining balance, so they become clumsy, they experience headache and facial tingling. Now, eventually, the patient may also experience vertigo, or a sensation that the room is spinning or rotating or revolving. So it's very important for these patients experiencing vertigo to be positioned flat so that they don't risk falling. Now, your acoustic neuroma is usually diagnosed through magnetic resonance imaging or MRI. Now, when a patient has undergone caloric stimulation tests and water is used, it has to be drained after the test. Your vestibulocochlear nerve is also responsible for the sense of hearing. Therefore, when we assess the patient, we could actually do Rinate test. Now, your Rinate test involves using a tuning fork and actually sending it to vibration, placing it on the mastoid bone of the patient, and then after that, near the auditory canal. Your Rinate test detects conductive hearing loss, and this is carried out by comparing air conduction and bone conduction of sound. On the other hand, the Weber test could also be done. Now, your Weber test can detect both sensory neural and conductive hearing loss. So it also involves the use of a tuning fork that is usually placed on the patient's head. And then you ask the patient in which ear the patient is able to hear the sound better. So if the sound is louder in one ear, which is the affected ear, then the patient would more likely have conductive hearing loss. Now, however, on the other hand, if the sound is heard better in the normal ear, then the patient is having sensory neural hearing loss. So your Rinate test or Weber test could actually give information if the patient is suffering from deafness.
You won't get away.
Now, let's try to apply what we just have learned by answering a sample question. So which of the following statements is made by a patient are associated with abnormalities of the vestibulocochlear nerve or cranial nerve 8? Select all that apply. Option 1, I feel as if I am spinning. Now, this usually indicates vertigo, so it is indicative of an abnormality of cranial nerve 8, so we put a check. Option 2, I'm having difficulty hearing. So once again, this is indicative of deafness, so we put a check. Then I have ringing in my ears. This indicates tinnitus. So once again, we put a check because that's an abnormality of cranial nerve 8. And then I don't smell anything. Now, this indicates anosmia, which is actually an abnormality of the olfactory nerve, not the vestibulocochlear nerve. So we put an X. And then option 5, my husband asked me if my eating just on one side of my plate is my way of dieting. Now, this indicates homonymous hemianopsia, which is an abnormality of optic nerve and not of the vestibulocochlear nerve. So we put also an X. So the correct answers are options 1, 2, and 3. So this is my shout out time. Congratulations to one of our NCLEX RN passers from Apari, Cagayan. We have Robert Ruma Pagulayan. He passed the NCLEX RN for the state of New York. Congratulations, Robert. So let's learn together. For more instructional videos, subscribe to my YouTube channel, Gapuz Mentors, and my Facebook page, Mentor Ray. If you have anything in mind that you want me to cover in my future videos, or if you're confused with some concepts and you want clarifications, please feel free to send me a note or a message through my email, mentor.raygapuz@gmail.com. And let's learn together. Disclaimer, the instructional tool is created to enable students to develop their test-taking skills. The question or questions and answers contained in this instructional video were patterned after the official publicly accessed samples from the RN test plan of the National Council of State Boards of Nursing, or NCSBN. The discussions and rationale presented in the video are based on the lecturer's research and are meant to provide an explanation for the answer or answers to the question or questions that is or are presented. The lecturer makes no claim, directly, implied, or otherwise, that the rationale discussed is officially endorsed by NCSBN.